Hello and welcome to U Plus AI's YouTube channel called Startup Reports. I am Ranga, and in this channel, I review startups that offer products or services at the intersection of healthcare and artificial intelligence. Without further ado, let's jump into our episode. In this episode, we review a startup named Verb Surgical. Now, Verb Surgical's mission is to democratize surgery globally. Now, what does that mean? Now, according to Verb Surgical, among so many surgeries that are done globally, there could be better consistency and standardization considering the variety of procedures that are done. So, they hope to achieve it by bringing in consistency and reducing the disparity in the surgical outcomes for the patients. And as the disparity in the surgical outcomes is reduced, it definitely means that the disparity in the performance of surgeons also reduces. Verb Surgical defines the evolution of surgery in these four phases. Surgery 1.0 was minimally invasive surgery. Surgery 2.0 is laparoscopic surgery, which I'm sure is pretty common across the world now and very popular. Surgery 3.0 is robotic surgery in very precision cases or where dexterity is required or very precise assistance is required. Then robots or surgical robots are used in a number of procedures today. Surgery 4.0 is defined by Verb Surgical as digital surgery. Now let's look at what that means. Digital surgery is essentially an end-to-end platform for surgery that enables surgeons to do all of their work, that is the preoperative planning, the intraoperative decision making and postoperative care, all in the same place. Most often, surgeons in the operating theater perhaps have to deal with multiple tools and interfaces to do all of these things. What digital surgery is a combination of different aspects to give you a consistent interface and one place where all of this can be managed and done. So digital surgery is not just robotics or advanced instrumentation. It's the combination of that with enhanced visualization, connectivity among all the components, and the use of data analytics and machine learning to sort of spot patterns and surface best practices in the surgical procedures. So what's in it for the surgeons? Why would a surgeon really use this platform? Well, quite simply because, first of all, it's one place where the entire operating procedure as well as the preoperative and postoperative follow-up can be done. So definitely, it saves surgeons the hassle of dealing with multiple tools. An important aspect is that this platform would allow surgeons to share comprehensive surgical procedure data. And why would they do that? Well, simply because if multiple surgeons across the world shared their surgical data, then the best practices could be surfaced by the platform with the help of machine learning and artificial intelligence. So what's my take? One is that the connectedness in the operating room is super valuable. Now, even in software development, we have multiple tools. One for planning, one for bug tracking, one for reporting status. Now, if all that came together, definitely the software developer's job would be a lot more easier and a lot more consistent. The same experience is what is being thought of for the surgeon. If everything is brought together in a single tool or a single interface, it definitely minimizes distractions for surgeons and quite obviously enhances the surgeon's experience. Surgical cases come in all shapes, sizes, variations and complications. That is, humans, even though they may have the same complaint, let's say, for example, they have kidney stones. Now, some people are obese, some people come with diabetic complications, some people have had a prior cardiovascular event history. So given all these factors, the surgeons, who are humans, must think of preoperative planning, managing the surgical procedure, and then the post-operative follow-up. Now, humans are doing this today, but the chances are that they may miss to spot some patterns, given the complexity and diversity of human complications. This is exactly where machine learning is well suited to arrive at these patterns across surgeries, and especially if this platform, if surgeons can share procedural data, maybe of the same types of surgeries across different patients, certainly the best practices and the patterns among those surgeries will get surfaced. So definitely a very useful application. Thank you. I hope you enjoyed the perspective. If you did, please like the video on the YouTube channel. Do connect with me, Rangaprasad Sampath, on LinkedIn, and do follow my online handle U+AI on Twitter, SoundCloud, and Medium. I'll see you again in the next episode.